cannot have external evaluators coming to your school to evaluate your school when you, as the school head, have not evaluated your school. The school self-evaluation will state very, very strongly your strengths and the weaknesses of the school. If you have done so, you will know those areas you need to improve upon.
The school development plan is a master plan for improving the school. And this SDP must be based on a realistic analysis of the current situation in the school and must include the diverse views and contributions of key stakeholders like board of governors, parents, teachers, and even the pupils.
Participants were also given an opportunity to ask questions while the facilitators provided answers.
I want to ask, where does international school stand? We have international schools without mentioning it that don't follow the Nigerian curriculum and they don't write national exams. Then I want to ask, where does the country and the children they are grooming, where do they stand when we have schools like that?
International schools are not supposed to be meant for Nigerian students. They are schools established by embassies, high commissions, and all the rest of them for their own citizens.
How do we carry the private school along when it comes to setting school calendar? Why don't we factor it in such a way that the calendar will favor both private and the public school?
The job is that there is a committee now in place set up by the Honorable Commissioner as a follow-up from the stakeholders meeting we held a couple of weeks ago. For the next 2 or 3 weeks, the committee should come out with what should be the norm for private schools as per resumption, the number of people that should run, and so on and so forth.
Let's say before the very first year you come into the school and you find out that the school is not well organized the way you expected. What is the penalty?
Well, if we discover that you are in the school business and you are not ready to improve, the best thing is to advise you to close down. And I think going to make an assignment. We cannot continue to produce children that are not fit for the economy. I think it is our responsibility to ensure that those who are in education will run it well.
Some of the facilitators in an interview with Education Report on TV spoke on the importance of the Quality Assurance Evaluation Seminar.
Schools are expected to do self-assessment and the government will come in and validate. The intention is to have a better learning outcome, a richer learning outcome. We want our students to come out from Lagos State government or public schools or private schools and be on the same page.
Focus is not about the teachers. The focus is not about what has been provided. It is about our learners.
It involves all stakeholders. Everybody does the evaluation. We have the internal evaluators, which is the school, and we have the external evaluators, which is the trained evaluators in quality assurance.
There is a need for a change in education, and quality is just the in thing. That's the focus, quality of education.
We are trying to work, on the head teachers, the teachers, to improve their capabilities so that they can provide for the learners what is supposed to be provided for them so that they will be achievers.
The participants also shared with Education Report on TV the lessons learned at the seminar.
Definitely there are merits. The only demerit is laziness. The only demerit I'm able to lay my hand on is laziness. If only the school owner is lazy, if he's not ready to meet up with the quality he wants for that school.
You now know your focus. You know how to plan your school. You know where you are. You can plan to where you are going. And all those things we have been taught here today will assist us a lot in meeting our goal or our objectives.
Today is my greatest day of being in a seminar like this because I've learned a lot
that it is good for teachers to go for a seminar for improvements. When you are going out for seminar, you learn a lot of things. You improve yourself and you'll be able to work on our children better.
It's a very nice seminar, and just as the saying goes that wisdom is the principal thing, I think I've acquired reasonable knowledge that will help in the administration of our institution of learning.
The project director, Lagos Schools Online Project, appreciated the officials of the Ministry of Education for their contributions while stating the importance of the seminar.
We are indeed very, very grateful and honored to be appointed to undertake this assignment. And then to the participants too who came, we are grateful for their time. They left their schools, they left their work to come here, and we're quite pleased with the outcome.
Conclusively, with the participants were major stakeholders in the education sector, gaining so much knowledge and new ideas, then it is worthy to say that Lagos State will be a model of excellence in the provision of education in Africa.
We have a lot of programs in the school system. The biggest is the School Health Club. And the School Health Club took off middle of 2011, July 2011. And we have seen a lot of interest in health-related activities. We promote hand washing, especially hand washing, personal hygiene. Apart from hand washing, we encourage our students, especially the senior ones, to look out for health-related matters that they can report. So they're like health marshals in the schools that they attend. The teachers are, there's a dedicated teacher for each club, and the physical education teacher is part of the committee, part of the organization for that school. We also have the school sick bay program that's coming. We just finally procured the furniture and equipment that will go into the sick bay. We have picked 70 pilot schools to to set up the sick bays. The Health Volunteer Program, which is a program that converts bachelor's and HND of various degrees into healthcare workers. Their health volunteers will be manning these sick bays and reporting to the primary healthcare center affiliated to that local government. So in this way, we have a continuity in healthcare from school to the local primary healthcare center, back and forth. We will hope to catch up on immunization that way too. We have the Teen Friendly program, and it's focused on sexuality, sexually transmitted infection, self-esteem, abstinence. We bring them together. There's a play area, they have table tennis, they have computers. It's a supervised environment for a productive, interactive session. With the School Health Club, the major challenge was to get committed stakeholders, because it's a volunteering program. There's no special stipend. It's just a commitment to improving the awareness, environmental awareness, personal hygiene, and integrated above standard healthy culture. in our children. So getting people to come together and do this is almost as if you had a PTA meeting going on. The thing that I foresee, which may not be in the immediate future, which we're talking with the Ministry of Education, is the implementation of presentation of immunization records before school starts, especially for the 5-year-olds and above, or even less, because we're having so many gaps in our immunization uptake that if we are to cover our MDGs 4 and even 5 and even 6, we need to put a screener at the entrance into the school system where we can do a catch-up immunization for the children, 5-year-olds that are going into primary school.
Education Report on TV, promoting excellence in education on television nationwide.